Joining me now is Dr. Michael Glassner. Dr. Glassner is the founder and medical director at Mainline Fertility and Reproductive Medicine. Dr. Glassner, thanks for being with us.
Of course, thank you.
So are you surprised that this is where we are, or did you see this coming?
Not surprised, because it's essentially a marriage of two scientific advances that we've been working with. Crispr has been being used for treatment of HIV, for cancer research, and locating a genetic defect on an embryo we've been using in the IVF centers with pre-implantation genetic diagnosis, whereby a couple who has an inherited disease like Tay-Sachs, cystic fibrosis, can come in, we can create embryos, identify which embryos are affected and which ones aren't. So now we have a marriage of CRISPR and this genetic testing with the hypothesis of being able to correct the defect.
It was really just a matter of time, it seems.
Yes, yes.
In the report, we heard it described as cutting and pasting. Is that how you describe it? Well, in simple terms, how is this done?
Microsoft Word. Microsoft Word, search and replace. And that essentially they are creating the word that they're going to search for on the DNA, and then they send the CRISPR entity into the cell, and it looks for the DNA and cuts it away. The concern is, like with Microsoft Word, if it finds a word that it was not supposed to cut away, like if it's looking for resent and it finds present. And so the concern with this is whether it's cutting away any other DNA material, which would therefore cause other medical problems. And then going back to our iPhone, once you cut it away, the hypothesis was that you could put synthetic DNA in. The landmark work done in Oregon, the embryo itself repaired itself with the maternal aspect. And the concern is whether, just like autocorrect on your phone, whether that correction is done appropriately or whether the wrong words were put in there. So that's the concern. The concern is having a missed target, so it's not just hitting the area it's supposed to, but another area. The concern is partially correcting it, or the concern is correcting it and correcting the error, but then not fixing it appropriately.
Mutations that could form from this, that could develop from this. The other concern, of course, is the ethical issues that this raises. In your opinion, is this the right direction to go?
It's a slippery slope.
Sure.
I think that it's a dramatic landmark study, and I think it's going to lead to many more discussions, and I truly believe one day CRISPR will be offered in the IVF centers, just like we offer genetic testing. But even the study itself, you're taking an egg, fertilizing it with sperm, making the correction, and in this study, they had 58 embryos. I think they corrected it in something like 72%, but then they destroyed the embryos on day 3. And in my practice, and all the practices in IVF centers, there's that moral or ethical tapestry that we all live in. And some people, when the egg and the sperm meet, creates life.
Sure.
And therefore destroying an embryo, even in this study, is an ethical dilemma. But moving forward, who can do this? Even now, we have the ways to know which embryos are affected by more than 10,000 inherited diseases. Can people afford IVF? Can they afford the genetic testing to achieve that goal of a healthy baby? This is one step further. So there's the ethics of this study being done now. There's the ethics of who will be able to do this.
Have access to it.
Correct. But then that slippery slope of, which is discussed, blonde hair, blue eyes. I mean, there are some clear traits that could be determined or manipulated.
Tell us about that. What are we talking about here? Could race be manipulated in any way? Obviously, he's mentioned hair color, eye color. Well,
I mean, the good news is the United States has a lot of safeguards. The NIH, the FDA will not fund any research that involves germ cell genetic manipulation, which this is what it is. A germ cell is the egg or the sperm or the embryo when it's first occurred. And even look at, in February, the National Academy of Science and Medicine said that you can do basic research on genetic manipulation, but not germ cell that you will then implant into somebody, and therefore not just change that individual, but change generations to come. And that's one of the concerns. We don't know what happens the next generation down and the next generation down. Most things that people would gravitate to, you know, athleticism, intelligence, are multiple traits. So it's not like you can turn a switch and have somebody be smarter or somebody be more athletic. But there are some clear characteristics that you could potentially adjust. Now, even now in the laboratory when we do IVF, we can test an embryo and tell you which ones are healthy, which ones aren't. And there would be a way, if we did a more advanced testing, next generation sequencing at a more advanced level, you could determine which embryos will potentially be blonde-haired or blue-eyed, or which ones might have a higher cancer risk.
You can tell your patients that if you do this more advanced, I'm guessing probably maybe more expensive testing?
It's available, no one's doing it because of that ethical dilemma. Right now, we'll keep it simple. Tell you whether the embryo is chromosomally normal or not, tell you whether it has one of these inherited diseases if you're looking for it. So to this point, we've never done it because of the ethical concerns. And once again, it's that old story, the science is advancing faster than the ethical conversations. But fortunately, this study does not mean that this is happening today, tomorrow, next year. 72%, 74%, that's a great percentage. You got to be closer to 100%. And you have to make sure that this wasn't just one peculiar issue relating to this one genetic abnormality relating to the cardiomyopathy. I mean, we're talking about thousands and thousands of diseases that could potentially benefit from this. But again, who can get to it, and will it ever get to that point?
You raise, of course, also the fact that there already is regulation related to this type of testing and this type of research. So certainly that's the next piece of this in terms of regulation and discussion laws that would impact the ability of this gene editing to move forward.
In the United States. So what's going to happen is, while these regulations are in place, which they will stay in place because, again, there's a lot of controversy, there's a lot of arguments, we'll see it move off-site. We'll see it in other parts of the world where they won't have these regulations. So it's coming, and we got to be ready for it, and these conversations need to occur.
I would imagine, too, even if we do get to the point where it would be available, it would be pretty expensive. And this, I think, is part of the point you raised about access.
Correct. A typical IVF cycle is $10,000. The drug's going to add another $3,000 or $4,000. Genetic testing of what we do now would be another $3,000, so you're already up to $17,000. Then you got to add this new technique, which right now doesn't have a price tag.
Dr. Michael Glassner with Mainline Fertility and Reproductive Medicine, thank you for being with us, and thank you for your insight.
Of course, thank you.